Please put your hands together as I welcome Ms. Kalpana Sharma, editor timesnow.in, to please join me on this stage. And now I invite our esteemed panelists to join the discussion. Please welcome with a round of applause Dr. T. Rajeshwari Reddy, obstetricians, advanced robotic and laparoscopic surgeon. The round of applause has to keep going on, ladies and gentlemen, while ma'am joins me here onto the stage. Dr. Neeraj K. Yanamandra, senior consultant, obstetrics and gynecology, laparoscopic and hysteroscopic surgeon. With your round of applause, let me invite on stage Dr. Shivranjani Santosh ma'am, once again, pediatrician, social activist, first aid trainer, and widely known as the ORS Lady of India. With your round of applause, let me invite on stage Dr. Vandana Hegde, clinical director, chief IVF consultant, and gynecologist, Hegde Fertility. Ladies and gentlemen, please put your hands together for our lovely moderator and the panelists here on the dais. Ma'am, the stage is all yours.
Thank you. So yes, first of all, I'd like to, reimagining the future is the name of our panel. So I would like to ask each one of you that, down 10 years, say, or 5 years, how do you see the entire landscape changing in terms of maternal health and well-being? Child health, everything that you can think of. What do you think that should be the future?
The future should be such that the women are empowered to take care of their health and their children's health and the health of their families. So for that, we need to raise awareness. So empowering them is the most important thing according to me. And we have made great strides in terms of maternal health. More than 90% of institutional deliveries are happening in institutions, but at the same time, exclusive breastfeeding rate for the first 6 months has fallen to close to 50%. I would like to see that change. I would like to see that go to that 90% at least. Yeah.
Beautiful. You want to go next?
I think India has actually done wonderfully over the last few years, and that is mainly because of, corporate hospitals, we should say. Definitely they have improved the standard of care. But what we also need to understand is that 75% of the doctors are in India, in the urban India. So definitely we have got the entire rural population that I think today we are in the right mindset and the right position to think of, because we are coming from independence era to this, completely India that we are very proud of today. So that I think could happen only with, private-public partnership is something that I think can work where, there is no way that anything can go forward without having profitability. And I think corporate hospitals have done a, very good job. And they've invested into the tech and infra, which has given this quality of healthcare. Because I have patients coming from US who tell that Indian healthcare is way better than US healthcare. So what we should take from here is only, I think, public-private partnership. And that will be something that we should try in the next decade or so. I think with the help of AI and telemedicine, if we can give quality healthcare, which can go and deliver to the rural, that's something the people can think of, yeah.
Lovely.
Thank you for the question. Now, in a country as diverse as India, in terms of demographics, it's difficult to have, I think, a uniform expectation in 5 to 10 years' time. From an urban population, say a city like Hyderabad, for example, what you would expect in the next 5 to 10 years is, with the AI gadget, because we're in an AI summit, AI and digital platforms which we have, I would expect that we as healthcare providers will be sitting with women with their smartphones and with their maybe wearable gadgets and looking at the way they have been looking after their body, as Sir has said just now, that they need to prioritize their health. Everyone has to prioritize their health. So we sitting together and making plan for their pregnancy, for example, or any health issue. So it is individualized care we're looking at. When we look at a larger picture in terms of looking at rural population, for example, we're looking at remote monitoring, telemedicine, we are already doing telemedicine a lot. We're doing lots of video consultations these days thanks to the technology that we have. And also reaching out to them and identifying those that vulnerable for health issues, to identify them, strategize them, and maybe bring them for healthcare in a more modern setting. That's how I would look at it in 5 to 10 years.
Great, and I do hope that comes true.
Yeah, good evening, everybody. So for me, I think in the next 5 to 10 years, I basically see a lot of preventive care because as the technology is advancing, it is bridging the gap between people and the services that are there. So with emerging AI technology, of course, there's a lot of prediction that goes on in pregnancy, that way ahead of time we know about hypertension in pregnancy or diabetes or growth retardation or prediction for preterm and stuff like that. So definitely people are more aware and they're more prepared. And as we move forward, I think in the next 5 to 10 years, it will be more about preventive medicine. So as in, because we see a lot of hormonal disturbances and, diseases like endometriosis, polycystic ovarian syndrome or adenomyosis, things are going to get better because people are going to be more aware. They know when they should reach out to the doctors. And also, even if this diagnosis is made in remote places, they have a way to reach out to us and get the right treatment. And the prevention of all these diseases starts from teenage, right from when they are 12-year-old, 13-year-old. So definitely preventive medicine care would be the priority in the next 5 to 10 years.
Beautiful. And we have the ORS Lady of India. I'd like to ask you that, what lessons do you feel India has learned in child health care that you feel really proud of? And what are the gaps?
Oh, I feel very proud of our Pulse Polio program. India has eliminated polio. From 2012, we didn't have a single case of polio due to wild polio virus. It's amazing. Even now, Pakistan, Bangladesh, they still have polio, but India doesn't have. Similarly, the way India worked towards malaria eradication, that also tremendous work has gone into it. Integrated child services program, providing nutrition to children. We have done amazing things like which many other countries with similar number of people, population couldn't do.
And
so I'm very proud of India for that.
Yeah, and anything that you feel, something that we should work towards, something where we are lagging a bit?
There are many things we are lagging a bit also. So, see.
Your top choice.
Top choice, honest, fair labeling, fair marketing, and fair branding when it comes to food. Very importantly, controlling this indiscriminate sale of irrational combinations of drugs, jeopardizing the lives of people. Yeah, we really, really need to work on that. And this junk food pandemic, this is where India needs to really, really focus on. Childhood obesity is a pandemic now. And it's like do or die right now for us. So we have to really focus on that.
I'm sure with you championing these causes, we will fight it. My next question is to you. We recently had a report, Dr. Vandana. We recently had a report on India's infertility crisis. What do you have to say? How is IVF, in which direction is it growing, and is it accessible? What are the things that you feel can be a game changer for the IVF industry, if we say?
So actually, if you look at India's IVF success rate, we are almost on par globally. So we are reaching success rates internationally, we are on par. But where we fail is to give the same treatment to our patients because it is not accessible. And there is a great demand for patients, and the drawback is it is till now WHO didn't consider even it as a disease also. It's very recently that they accepted that infertility is a disease, because of which insurance kept it out. But today, because it is accepted, we should look at, infertility being covered by insurance where acceptance. But now in our own clinic, when we actually looked at certain policies which covers insurance, or we give these, options of 0% EMI, many of the patients are not even able to come into that category because they don't have that kind of income also. So that means there is a great demand for infertility services, and accessibility is becoming an issue. Now, how to bridge that gap? Definitely, if you look at infertility, it was not even being taught in medical colleges. There was no department for infertility, and now right now also it is not there in many places because it was not there before. It was not because maternal child health took priority. Today, to improve the, the maternal death, they took such a long time. To improve the child survival, they took. So there, definitely India has done a good job. But today we have these programs of MCH, super specialization in infertility, which have come. That's where the departments have started. So definitely we can look at, serving the society, because they are going to do free treatment of IVF. That is very much required. And as you brought about rightly, fertility decline. So India is at now at 1.9. Which is below the replacement level, which is considered as 2.1. So everybody who's scared that AI is going to take your job, we are not there also in future. So I don't think we should be worried about that. We should worry about we being there when AI is, going to do that job. So there, if you look at it, IVF is the future. It is going to be there. There is no waste because, as Madam put, junk food is there. Metabolic diseases are there, fertility is declining, male fertility is increasing. So definitely infertility is only going to increase in the future, and having quality services. See, IVF is one science where people are camouflaging in the failure rate. Because see, any other field in medicine, your bone is broken, the patient knows tomorrow his X-ray is corrected. He knows the doctor delivered the complete treatment correctly, perfectly. IVF, 50 to 60% success rate, 40% failure rate. So you can have very bad centers surviving here on failure rates. So that is something I would request the government to be very careful. Today we are very happy with the ART law of India. That's the best thing that could happen, where they brought in the ART law, they brought in the surrogacy law. So with that in place, we are looking only at, implementation now. They have brought it in order. We are taking the baby steps, of they need to get the data of India now. Nobody knows how many IVF cycles are being done in which corner of India, what kind of cycles are being done, which gamete is being used. So this is, it's our genetics, right? It's our DNA. So I think should be priority to protect all this. So if the government can only implement this correctly, and then we can look at delivery of quality. Again, as I mentioned, there is no way India can go forward because we don't have that much money to invest everywhere in all of our departments. Right. So they should look at somewhere, compensating patients initially before putting up that infrastructure, compensating that service which they are using in a private hospital for a subsidized price. So right. That's something that can work, because IVF is a failure rate. How much can government also do IVF? It's going to fail for some patients. That means they have to fund it again. So it becomes difficult. So that is something that even patients don't understand why government hospital is not giving. It's a lot of invest because nothing in India is produced in India. Right now, the IVF that we do, the culture media comes from abroad, the pickup needle, the ET catheter, everything we are, importing. So giving that at a subsidized cost for repeat cycles is a little difficult. But there is a need, as you told, replacement level, we have already dipped. So this is something that I'm sure all of us, will come to some way to, try to improve the accessibility for the non-affordable patients. And I'll tell you, it is the same. The incidence or the prevalence of infertility is the same. It is not different between urban and rural. So that's something that will probably change because MCH has come. It's a department that have opened in medical colleges which are going to make a big difference now. Yeah.
Okay. I hope that helps. And Dr. Neeraj, I want to ask you that, robotic surgery is being seen as the future of women's healthcare. What would you like to say?
Right. Robotic surgery these days, I would imagine last maybe 2 years or so has taken a big leap in India, and we've started talking about it. First time when I went for training in Texas, that was in 2008 for robotic surgery. That is when I was in UK, I was training there, and from there I went for robotic training. And in those days, Texas, had more robots than whole of Europe and UK had. So they were so ahead of us. Now, and we've been all happy with doing laparoscopic surgeries. Now, if you compare laparoscopic surgery with a robotic surgery, there is no surgery which you can do robotically that cannot be done laparoscopically. All these 3 decades, at least I can imagine, early 90s up to now, we've been doing all surgeries that robot. Robot definitely has advantage in certain areas of gynecological surgery, where, say, the disease is in a very difficult anatomical space and you can't reach it with straight stick surgery, which we say laparoscopic surgery. Because of increased dexterity of the instruments of robot, you can reach those areas in the pelvis to do difficult surgeries. And otherwise, if you look at patient outcome, it's not only my belief, there is scientific evidence which has, and there are several papers which are confirmed, that the outcomes from patient's perspective, if you talk about pain relief, need for painkillers, quicker return to work, quicker recovery, less blood loss, and so on. There's a huge list of things which robotic surgery and laparoscopic surgery have the same. So there's no difference in patient's outcome. There are other factors which, of course, are important. Surgeon's fitness, for example, is important because your shoulders should not be strained. Robotic gives you that benefit. And there are very few surgeries in gynecology where robotic specifically has a huge advantage compared to laparoscopic surgery. Otherwise, laparoscopic surgery is here to stay. And robotic surgery, of course, is picking up in India, which is good. But there are other issues which I don't think, because of lack of time, we can discuss those. But yeah, it still is in very infant stages now compared to laparoscopic surgery in India.
Thank you. And Dr. Rajeshwari, I would like to ask you that, high-risk pregnancies still remain a major challenge in India. What can be done to really tackle that problem?
Okay, definitely high risk is going to be there, and it's only going to increase with time because the lifestyles are changing. And as I told you, right from childhood, as Madam said, because of this junk food and lot of screen time and not maintaining the biological circadian rhythm, sleeping late, all this is starting to take a toll on a child's health, and then through the teenage. So the beginning has to be, where do I say, from birth only actually. So just sticking to home cooked food or a normal thing. See, because technology is supposed to make life easier and technology is supposed to give us more time. So what are we doing with the more time? Yeah. We're barely doing anything great. So as Madam mentioned about childhood obesity, so we're seeing a lot of people with hormonal imbalances and a lot of issues from teenage, and that is what gets translated into infertility, and that is what gets translated into high-risk pregnancy. So the preventive medicine has to start, that's one point. But there is going to be more and more high-risk pregnancy, also late marriages because of education or many other reasons. The culture as a society, we are changing, and even when they are married, they want to plan little later. So, I practice in Gachibowli, the financial district. So there 35 years is no age at all. You cannot call a 35-year elderly, and definitely 35-year-old patient, if they come and I say, why are you not planning pregnancy? They get offended. Why should I plan? And then recently I had a 41-year-old and she came, I said, just do your fertility test because when we don't tell, they're like, no one mentioned it to me. So I said, why don't you just check your fertility levels, your AMH levels? She's like, I'm newly married, what are you talking? So, things are changing. So with the age and of course obesity, lifestyle, and basically I think more than anything else, high stress. So the body does not differentiate between physical stress and mental stress. So definitely discipline is not there. As Sir said, discipline is extremely important when it comes to health, more so for women. For women, it is more challenging because our brains, our gut, and our ovaries are bidirectionally related. So one gets conked, then the system goes haywire. So definitely high-risk pregnancy is here to stay. More AI, more prediction, more care, and it's only going to get that much more worse. Even with emerging technology, high risk is going to be extremely challenging.
I do hope we are able to tackle that problem, and thank you so much for joining us today. Thank you.
Thank you. Ladies and gentlemen, let's give a thunderous round of applause to our panelists and moderator for their valuable time and much insight. Thank you. Ma'am, I would request if you can please stay back on the stage. Thank you, Ms. Kalpana, for joining us here on the stage. I would request Mr. Shamsher Singh to please join me back onto the stage and present a token of appreciation